Thanks for being here with us today for Moms Everyday, everyone. We have Dr. Ghassan Moufarrege here with us today. He is an anesthesiologist who is specializing in pain management at Cabell Huntington Hospital's Pain Management Center. Doctor, it's great to have you with us. We appreciate you being here.
Thank you.
Okay, so we want to talk to you today about some of the stuff that you help to treat and some of the different pain treatments that you use at the center. So, what are some of the different conditions, first things first, that you treat, or what are the most common things that you help to treat?
So, in our pain management center at Cabell Huntington, we treat a wide variety of conditions. We are a comprehensive pain management center. The most common conditions that we see relates to low back pain, neck pain. Also, we treat pain related to joints. Like, for example, if somebody had surgery on the joint but still have pain, or they don't want to have surgery, they want to delay it a little bit. So we can treat pain related to knees, hips, shoulders, elbows. We also treat pains throughout the body, literally from the head to the toes. Chest wall pain, pelvic pain, pain in the arms, legs, whether it's related to hyperactive nerves or muscle type pain. So it's a wide variety of conditions. I don't want to get too much into the medical terms, but people might recognize some of the conditions like chronic pain from shingles or fibromyalgia, or phantom pain in the arms or legs, or cancer-related pain, or neuropathy. So these are some of the conditions that we treat.
That is a wide variety, and I think a lot of times when we hear pain, we think of joint pain or those types, but we don't normally hear of the later ones. So that's very interesting. So we want to talk to you too, because there's a lot of misconceptions that people have about pain clinics. So talk to us about some of those and what you see when patients come in.
Very good. Well, a lot of people, when they come to the pain clinic as a last resort, they want to try everything else. And that doesn't have to be the case. Nowadays, we have so many options for pain relief. So if you come to us early on, because we focus on your pain, we can look at all the other aspects, all the other help that you need that's related to your pain. There are actually certain pain conditions that it's better to come early. We can stop the pain cycle, and we can help better than waiting too much, and then the pain becomes really a complicated problem that's hard to solve. This is one of them. The other thing that people think when they think about pain clinic, some people, they don't want to come to the pain clinic because of the opioid concern. They don't want to be on opioid. They think the pain clinic, they're going to put them on opioid. Opioids really nowadays are just one tool that we utilize. There are multiple tools that we utilize. We focus more on interventional pain management. So this is one way. But even if we needed to use medications, opioid is just one medication. We have now several classes of medications that can help control pain without using opioids. This is one thing. The other thing is, some people, they know that we are interventional pain clinic. They are sent to us to have procedures done. And the first visit to us, they think they're going to have their procedure done at that same visit. So the first visit, usually, we really have to get to know the patient. So we go over their medical history, we do an exam, we look at their imaging studies if they have x-rays, and then we come up with a diagnosis and a plan as to what we want to do, and we have to submit this to the insurance company, and then we'll do the procedure. So the first visit is just we get to know you better.
Get to know you. You are not going to have a procedure done right there on the first day.
Exactly.
Okay, doctor, before we go, we want to ask you too, because a lot of people out there are dealing with these types of pains. If they need to come into you, what is the best way for them to set up an appointment or to contact you to do that?
Okay, it's very easy. You can call the number 526-ACHE or 526-2243. Of course, area code 304. This is one way. The other way is if you're working with a primary care physician or if you're working with a specialist, you can ask them, they will send you to us. So it's very easy. Either call the number or have your physician refer you to us.
Well, great. Well, doctor, thank you so much for joining us today. We appreciate it. Thank you all at home for joining us. Stay with us, though. We'll be right back.